Welcome to MediByte. Today, we're going to talk about one single type of bacteria that's behind a whole bunch of serious illnesses. We're talking everything from a kid's ear infection all the way to life-threatening pneumonia and meningitis. So let's jump right in.
So let me just start with a question for you. Do you think it's even possible for one tiny little bug to cause three completely different diseases like these? Well, the answer is a huge yes, and that's exactly why we need to talk about it.
All right, let's meet the culprit, Streptococcus pneumoniae. For short, we just call it pneumococcus. This little sphere-shaped bacterium is the mastermind behind what we call pneumococcal infections. And trust me, you don't want to underestimate it. It's a major cause of serious sickness all over the world.
Okay, so what exactly are we talking about when we say a pneumococcal infection? Really, it all boils down to how this one bacteria gets into our system and, where in the body it decides to cause trouble. How it spreads is actually pretty simple and super effective. It all starts when someone who's infected coughs or sneezes. That sends these tiny bacteria-filled droplets flying into the air. And then all it takes for someone else to breathe them in or just be in close contact. You can see why crowded places are the perfect environment for this to spread.
Now, here's something that might surprise you. This bacteria can actually just live quietly in the nose and throat of people who are perfectly healthy. They don't get sick at all, they become carriers, especially in the winter and early spring, and they can pass the bacteria on without even knowing they have it.
So that leads to a really important question. If a bunch of us are carrying this bacteria around, why do only some of us get sick? Well, the answer comes down to risk factors. Certain groups of people are just way more vulnerable. And the list of who's at risk is, well, pretty long. It includes the very young, whose immune systems are still getting up to speed, and older adults, whose defenses are starting to decline. Also on the list is anyone with a long-term illness, like heart or lung disease, or anyone with a weakened immune system for any reason. And finally, things like smoking, or even just living in close quarters, like a dorm, can really up your risk of getting a serious infection. Okay, so let's get into the nitty-gritty. What actually happens when this bacteria wins and causes an infection? Well, depending on where it goes in your body, it can show up as a few very different and very serious diseases. The most famous illness this bug causes is, you guessed it, pneumonia, which is an infection deep in the lungs. And let me tell you, when pneumococcus is the cause, it has a reputation for showing up fast and hitting you hard. The symptoms are usually really sudden and intense. We're talking about a fever and chills that just come out of nowhere, feeling short of breath, and this really distinct, sharp pain in your chest that gets way worse when you try to take a deep breath. A cough that brings up rust-colored phlegm is another classic sign.
Now, let's talk about an even scarier scenario. If the bacteria get into the bloodstream, they can travel up to the brain and spinal cord. And if that happens, they can cause pneumococcal meningitis, a really dangerous infection of the protective lining around your brain.
The classic signs you hear about are fever, a really bad headache, and a stiff neck. But here's what's so important for parents to know. In babies, the signs can be totally different. They might just be really fussy, extra sleepy, or not want to eat. It's much more subtle.
And the consequences of meningitis can be absolutely devastating. Even for those who get treatment and survive, up to half of them are left with lifelong problems, things like hearing loss, seizures, or developmental delays. Okay, so we've gone from the really severe to the really, really common. This exact same bacteria is a top cause of otitis media. That's just the fancy term for a middle ear infection. And it's one of the main reasons kids end up at the doctor's office.
And just how big of a deal is it? Well, Streptococcus pneumonia is to blame for about 20 to 40% of all middle ear infections in children. That adds up to millions and millions of cases every single year.
So, the good news here is that we aren't helpless against this thing. We absolutely have ways to fight back. Let's take a quick look at how doctors figure out what's going on and what the usual treatment plan looks like.
Diagnosing it really just depends on where the infection is. If pneumonia is suspected, a doctor's going to want a chest x-ray. If they're worried about meningitis, the gold standard test is a spinal tap. And for a simple ear infection, it's usually just based on the symptoms and taking a look inside the ear.
The main weapon we have to fight pneumococcal infections is antibiotics. And for a long time, penicillin was the #1 choice.
But, and this is a big but, because we've used antibiotics so much, some types of the bacteria have learned how to fight back. This growing antibiotic resistance is a huge problem, and it means doctors sometimes have to use different, more powerful drugs. And you know, that problem of resistance is exactly why this next part is the most important thing we're going to talk about today. Because when it comes to these diseases, treatment is great, but preventing them in the first place, that's a whole lot better. So, when you think about how serious these illnesses can be, stopping them before they even have a chance to start is, without a doubt, the best strategy. Prevention is just everything. So how do we do it? Well, part of the challenge is that there are more than 100 different types or versions of this bacteria out there. It would be impossible to protect against every single one. But this is where we got clever. The vaccines that we have are super smart. They are specifically designed to go after the handful of types that cause almost all of the really severe invasive diseases. It's a targeted approach, and it makes vaccines our absolute best tool for protection. Which, of course, brings us to the most practical question for all of us. Who should be getting this protection? And the great news is the recommendations are very, very clear. The game plan is pretty straightforward. Vaccination is recommended for all little kids as part of their regular shot schedule. It's also recommended for every single adult who is 50 years or older, and finally, for anyone at any age who is in one of those high-risk groups that we talked about earlier. Look, understanding these risks and, more importantly, knowing about the power of prevention, that's the key to keeping you and your family healthy. If you found this breakdown helpful, do us a favor and hit like, share it with someone you care about, and subscribe for more explainers just like this one. Thanks for watching.